Well, hey, everybody. Thank you so much for that. Yay! The world premiere is so exciting. Thank you so much. Thanks, everybody, for participating. That's incredible. Thank you so much. Diane, Danielle, can you give a little, what did you think? How did our Dawn do?
She was amazing. And it was so good to see her in that. I'm sorry.
That's okay.
I'm so glad we got it.
Yeah, everybody just did a phenomenal job. Everybody, and I'm even reading the comments below, and the emphasis is compassion. Take the time, empathize. And I'm sorry, I'm laughing to myself because I feel like every time I talk, I cry. So I promise I'm not a big crybaby all the time.
No, it's quite
but
right.
yeah, it's being compassionate towards this
and
beautiful
and also being present for that. Was that
it can be different with everybody, but everybody's trying to say something.
extra?
Yeah.
Thank you so much.
In the very beginning, when Dawn would pull somebody's hand, they would pull it away. She's going to bite me.
Oh,
And I said, no, she's not. She wants to take your hand and kiss it. And, you know, it just changes everything when they realize, no, she's not going to bite you. She's not going to hurt you. She just wants to show her love to you.
she just wants to love, and that's what she does. And to teach. She's the mentor. She's the teacher. She showed us all the way. Thank you so much for that. Joanna, what did you think? What did you think of the film?
It was very impressive because again, being there that day and then seeing it all kind of tied together is pretty awesome. And I did say that to Diane, this truly was a gift for all of us to have that piece with Dawn and the family. I just think that's just such a tribute. And so I'm so thrilled that we were part of it. And of course, you know, Dawn is one of many of our folks, and Alyssa as well. And yes, individuals, and they should be treated as such. And she was unique, and so are so many of our other folks that we support. So yeah, this is so important. This work is to get that word out, not just to physicians, but I guess the community on a whole should know this. And this is great work. Thank you, Rick.
Thank you so much. Thank you so much. And to all of our participants, I see that Ellie that was there, Katie's mom was there, and she's like, well done. And we can't wait, really important to hear what Katie seemed to think of that, because her opinion's going to carry a lot of weight on this as well. Dr. Keller, what are you thinking?
I was so thrilled. I mean, I was just so thrilled in all of our planning and putting this together. And really, the thing about it is that epilepsy is such a prominent medical condition in people with intellectual developmental disabilities. And the challenge is that this is about adults for the most part. And when people transition from pediatric care to adult care, that's where the bottom often drops out in many cases in terms of healthcare providers understanding or appreciation for someone that's had a lifelong developmental disability. And so it's a real problem for families. And I'm sure everyone, if they take the time, they can talk about their own transitioning issues that they can see themselves. And it's a real problem, but it's such a complex healthcare issue for many people. So bringing this type of program out, and really, we put the program together. We basically put the microphone up to the people on the panel and others that were participating, and they just tell their story. It wasn't, you know, all like, what are you going to say? What are you going to say? What are you going to say? And it's obvious what, you know, people just say and speak their mind, because they really got to listen to people who can tell a story. And it's about compassion. And really, it's about caring for the person as a person. And I really think you can't escape that. All the genetics and understanding about diseases and drugs and medications, if you don't really care about the person, really connect with them and their families and caregivers, it's tough. So I really think that's such an underpinning, Rick, that I see a lot in what you do in terms of bringing the focus and the visuals and the storytelling, just like we do here with this Project Frame. It's just essential, and I just live by it so much, Rick. And I want to thank you so much for doing this, because I really think it adds for us in ADMD and other organizations such an added value that we can't often do, like you can tell these stories and bring people and advocates together.
Beautiful. Thanks, Seth. It was just an honor to work with you on this film and to bring these stories out, and important to introduce these experiences, to introduce the beautiful Dawn and all of our great participants.
And they tell stories, because I've known Dawn for I don't know, decades or so. And really, I've learned a lot from the Crawleys, from Diane and, from Diane and Danielle. And I've learned, and working with the ARC and my colleagues here, is that I'm learning. And I basically, almost like an open book, tell me, help you. And I think that's the wonderful thing for advocates, is really they're there as a team to want to be part of the team. So really for those, we want to get this message out, listen to family members, really appreciate their needs and concerns. And so, and really watching Dawn is just an example of really the challenges, and understand the genetics. That, Diane, you were talking a lot about in the video about you didn't know, and there's this, oh, it's Dravet. I mean, it's such a important thing. So there's a lot of details, and I know, Rick, this is a great video to get this information out.
Amazing. And again, getting that diagnosis, Diane, as you made so clearly pointed out, and what a relief it was to finally have that diagnosis at 40 years old. But still, it was not Lennox-Gastaut, it was Dravet syndrome. And I've been to a Dravet family conference, and I've experienced that firsthand, and such a powerful community of families and individuals uniting and to support one another as well, which is so incredible to be part of that. I also want to acknowledge Pasa, who's part of the Richmond Community Services, who we did a lot of filming there as well, here in the New York area. And Pasa was just, thank you so much for your support and for your help in here. And Ellie, I see that you've commented a bit on this, and I'd love to know if I could bring Ellie on as a panelist. Ellie, would you have a moment to, I'm just going to make you a panelist to see if you don't have to say anything, Ellie, but you were part of this, and I thought I sent you the panelist opportunity. And if there's something you'd like to say, it would be great, as a panelist, as a mom to Katie, and also being part of that community that we created. I know that we're working on some other projects. I don't know, and Ellie is going to join us, and that's again Katie's mom. Can you hear us? Okay, there you are. Hi, Ellie. What you think of the film?
Well, let's ask Katie.
Oh, Katie's there! Yay!
You got her? I can't tell.
I
No.
don't see her yet. Let's see. No, not yet. I don't see her.
Hold on a minute. I'm all tied up to you guys.
Yeah, you have your New York. You have your New York. Oh, there she is. Hi, Katie.
Hi.
How are you?
Clockwise.
Rotated clockwise. I don't know what that means.
Turn it.
It's all right. No worries.
The husband
Turn
is
it that way.
turn it which way? This way. There.
There we go.
Is that her?
Yeah, there she is. Hi, Katie.
Hi.
Like, your haircut looks great. Your hair looks amazing today. That's right. Beautiful.
I thought it was excellent. It was
Yeah.
really very, very well done.
Right.
And I had no expectations.
Oh, there you go. And just for everyone to know that Ellie and I and Katie, we're going to collaborate on a new program here in New York, utilizing film, narrative, and photography to raise awareness of individuals and adults living with IDD in the New York area, and changing public perceptions of individuals living with IDD. So I'm really excited to start on that initiative with the AHRC and other organizations in New York, ADAPT, et cetera. So
Katie wants to say one more thing, if
hi,
you don't
Katie.
mind.
I was very nervous and anxious that you said that that
Oh, the bracelet.
the bracelet and also about my that I had seizures.
But thank you so much for sharing, first of all, for showing us your bracelets, because they're so beautiful and so important. And then also to have you talk and your mom talk about seizures.
Okay,
And I was a
enough,
lit-
Kate. Enough.
That's okay.
and I was a little down when you told my mom about the seizures.
No.
And we're so thrilled that you shared those stories, Katie. Thank you. You're going to help a lot of healthcare providers in training, practitioners, families, and other communities, because of your experiences, are going to be much more aware and have a better understanding of seizures in our adult IDD community. So thank you for sharing all your love and compassion and your support for us. So thank you for that. And again, we want to thank the WITH
Mommy,
Foundation.
do you
Quiet.
Do you want to say one more thing?
I just want to thank everyone else who participated in this. It was Rick, it's wonderful. Thank you.
Fantastic. Well, thank you all so much. This was great. I enjoyed it.
have
Now,
a-
again, this will have presence on our website.
And we
on
have
the
a-
program.
We have a wonderful question that it's from
Sure.
Robert Like. It says, are you planning to develop a facilitator's discussion guide that would go along with the film that can be used with medical students and other health professionals? Would be great to do this from a life cycle, lifespan perspective.
Great
Wow.
question. That's a great question.
Great question. Seth, can we do it?
Yes, we can do everything. I learned this from Rick Gadani. There's no. We can do everything.
That's it. Well,
Right,
you know,
Rick? I mean,
I-
seriously, I mean, that's a great idea because basically we can put out material and put it in front of people, but we need it to have legs and additional information. So that's a great comment on helping to use materials to add on to these.
Seth, can we talk a little bit about the important? Now, Seth is the former president of the American Academy of Developmental Medicine and Dentistry. There are in medical schools, there are chapters in pretty much every medical school in the country. There's so many of them, really kind of individuals collaborating and seeing individuals living with IDD and really passionate to take care of this community. Seth, can you talk a bit about the AADMD and how that could be a really good resource for us to create these educational programs?
Oh, thank you very much, Rick. Is that the AADMD, as you said, the American Academy of Developmental Medicine and Dentistry, and I'll put the link at the bottom here. We have both medical schools, dental schools, so it's oral health, medical health. So we are both national and international, and we really have I say a niche within the care of people with intellectual and developmental disabilities. And we are very holistic in our approach about this. And as you mentioned, we do appreciate that the future is really our students and residents that are going into practice. I would say old people like myself, getting older every day. Basically, we really do rely on people in training, medical school, or really probably even basically in probably earlier education, colleges, and then certainly medical schools and dental schools for people to learn and have the exposure and experiences. So films like this are really, paramount. So we definitely want to have a interconnectivity between not only with positive exposure and the ADMD to help our own students in different universities and medical schools around the country, around the world, to watch these, to learn from these, because it's a question of really, are they really going to get that kind of experience locally that they might or may not? So we basically we all gang together, we meet with each other. We have an amazing group of relatively, I'll say, young people who really are these great, leaders, future leaders in healthcare. So I think the future is bright, and bringing this material to them would be a strategy that we really want to do to kind of bring it out for them. So absolutely connecting the dots to the AEDMD and what you do, Rick, with positive exposure Project Frame absolutely is and Special Olympics. We also are connected to Special Olympics state chapters also around the country and connect to those like the ARC and other community support organizations. So connecting the dots and working together as a team is really the way to succeed. It really is.
Thank you, Seth. And also very important and very important for positive exposure is also to look across the allied health fields, really looking at dentistry and working with our dentists globally and creating those opportunities, but also looking into our nursing community as well. Nurses that are so often as well, right there, right in the trenches, right there, being able to tell those stories. So again, it's really important that we bring all of our communities together and to really kind of stand arm in arm, hand in hand, and create a better world for all of our individuals living with IDD and creating opportunities to have these often difficult but important conversations. So I want to thank all of you. I want to thank Diplodocus, also our film crew that we collaborated with, because they were amazing and such wonderful collaborators. And of course, the WITH Foundation for giving us this platform, this opportunity. And these are just the beginning. We're developing new platforms with our Frame programming. So we're going to have our Frame film there. We'll have links there, but this certainly piece will also be added to the Frame platform under the epilepsy or adult IDD community, but also also, this is starting and sparking new conversations. And I certainly hope together we will be able to have these conversations together and continue this complete and awareness about epilepsy in our adult IDD community. And thank you so much. Thanks, everybody.
Thank you.
Thank
Randy.
you
all.
very much.
Appreciate it.
Thank you all for coming on.
Bye,
Thank you.
Diane.
Have a
Bye,
great
Bill.
day, everyone.
Bye.
Bye, bye.
Sending lots of love. Thanks, everybody.
Thank you.
Thank you.